Men over 60, if you've noticed your morning erections aren't what they used to be, you are not alone. But what if I told you that hidden within your own body lie 3 simple pressure points used for centuries in medical therapy that can help restore stronger, more consistent erections naturally? I'm Dr. Vera Sterling, a urologist specializing in men's health, and today I'm revealing what most men never learn: how small, targeted pressure can awaken blood flow, nerve activity, and hormone balance without pills or procedures. It's not magic, it's medical science your body already understands. Let's begin. When men reach their 50s and 60s, they often begin to notice subtle changes. Morning erections, the natural sign of healthy circulation and testosterone balance, start to fade. Many dismiss it as just age. But as a urologist, I can tell you that's not the full story. The body doesn't simply stop working. It adapts, compensates, and sometimes loses communication between the brain, the blood vessels, and the nerves that make an erection possible. I've seen this countless times in my clinic. A man comes in worried that he's lost his drive, when in reality, his pelvic circulation has slowed, his muscles have weakened, and his nervous system has forgotten how to signal properly. That's where the science of pressure points becomes fascinating. Pressure points are not mystical concepts. They are medically mapped zones where nerve clusters, blood vessels, and connective tissues intersect. By stimulating them gently, we can restore responsiveness to areas that have become dormant with age. There are 3 key zones I teach my patients, especially men over 60, to focus on regularly. The first point lies at the base of the pelvis, near the perineal area, the soft tissue between the scrotum and the anus. This area is home to the bulbospongiosus muscle, a key component of erection control. Gentle pressure here, combined with rhythmic breathing, enhances venous return and helps strengthen the muscle's contraction reflex, leading to more spontaneous morning erections. The second point sits along the inner thighs, where the femoral artery and associated nerve pathways travel. Light circular pressure here, especially after a warm shower, encourages microcirculation and oxygen flow to the penile tissues. For older men, this can reawaken sensitivity and improve vascular elasticity, both of which are crucial for firmness and duration. And finally, the third pressure point is one most men overlook completely: the lower abdomen, just 2 fingers below the navel. This zone interacts with deep pelvic nerves and the pelvic floor diaphragm. Applying moderate pressure here helps stimulate the parasympathetic nervous system, the rest and restore mode responsible for initiating natural erections during sleep and early morning hours. What's important is how you engage these points. Rushing or pressing too hard can irritate tissues. Instead, slow, deliberate pressure, holding each point for about 30 seconds while breathing deeply, signals the nervous system to increase blood flow and release nitric oxide, the molecule that triggers penile expansion. Now, some men ask me, Dr. Sterling, can this really replace medication? My answer is not necessarily, but it can dramatically support natural function. When combined with improved hydration, light exercise, and stress reduction, these techniques often help men experience firmer, more consistent morning erections, sometimes for the first time in years. I've had patients in their late 60s tell me that after just 2 weeks of consistent practice, they woke up with a sense of vitality they hadn't felt in decades. That's not coincidence. It's your body remembering what it was designed to do. But there's more. These pressure points also help diagnose deeper issues. If one area feels numb or sore, it may be an early indicator of nerve compression, pelvic floor tension, or vascular insufficiency, conditions that can worsen if ignored. So before you reach for supplements or online quick fixes, take a moment to understand what your body is trying to communicate. Sometimes healing begins with awareness. In the next part, I'll guide you through how to properly activate these points step by step, when not to use them, and the medical red flags that every man over 60 should recognize before starting. When I teach men to apply pressure point therapy for better morning erections, I always emphasize one word: gentleness. At this stage of life, your body requires patience, not punishment. The goal isn't to force a response, it's to coax your circulation, nerves, and hormones back into rhythm. Let's start with the first point, the one located between the scrotum and the anus, the perineum. This is a vital area because it connects directly to the pelvic floor muscles responsible for controlling urination, ejaculation, and erection firmness. Place 2 fingers on this spot and apply soft, steady pressure while breathing deeply. Inhale through your nose for 4 seconds, hold for 2, then exhale slowly through your mouth. You may begin to notice a subtle warmth or tingling sensation. This is blood flow returning to an area that may have been underactive for years. Over time, this practice strengthens the neuromuscular connection and trains your body to respond more naturally, especially in the early morning hours when testosterone peaks. Now, moving to the second point, the inner thighs. Sit or lie down comfortably. Using your fingertips, locate the groove along your inner thigh, just a few inches from your groin. Gently trace small circular motions up and down this area, applying mild pressure. What you're doing here is stimulating the femoral artery and its accompanying nerve pathways. This improves oxygen and nutrient delivery to the penile tissue and helps reduce stiffness or fatigue in the surrounding muscles. I often recommend doing this technique after a warm shower or light stretching session, as heat enhances vascular response. Remember, good erections are not purely hormonal, they are vascular events, and your blood vessels need movement, oxygen, and stimulation to stay strong. Finally, let's revisit the third point, 2 fingers below the navel. This pressure zone connects with deep pelvic and lower abdominal nerves, areas that control the parasympathetic system, the rest and restore network responsible for spontaneous erections during sleep. Apply slow, firm pressure for 20 to 30 seconds while keeping your breathing relaxed. This simple act can help recalibrate the balance between stress hormones and sexual function. For men over 60, chronic stress, poor sleep, and anxiety often disrupt this system. When that happens, cortisol, the stress hormone, suppresses testosterone and limits nitric oxide production, the molecule responsible for penile expansion. That's why activating this abdominal point daily can have a surprisingly calming effect, not just physically, but emotionally. Now, let's talk about safety. Pressure point therapy is gentle, but there are times to pause and seek medical guidance. If you feel persistent pain, numbness, bruising, or notice a sudden loss of sensitivity, it may indicate an underlying vascular issue, nerve compression, or even early signs of diabetes-related neuropathy. Never ignore these symptoms. They're your body's warning signs that something deeper requires professional evaluation. Similarly, if you experience morning erections that are painful or prolonged beyond 2 hours, contact your doctor immediately. While rare, such conditions, known as priapism, can cause lasting damage if left untreated. For the majority of men, however, these pressure point techniques offer a safe, natural, and empowering way to reconnect with their own physiology. Think of it as a conversation with your body, one where you listen as much as you act. Beyond the physical benefits, I've seen profound emotional shifts in men who practice this consistently. They regain confidence, energy, and a renewed sense of youth. They stop viewing their age as a limitation and start seeing it as an opportunity to care for themselves with greater awareness and respect. I want every man watching this to understand your sexuality doesn't have an expiration date. It simply evolves. By learning how to nurture your circulation, manage your stress, and stimulate these key pressure zones, you can maintain vibrant sexual health well into your later years. As a urologist, I've witnessed firsthand how small, consistent actions can restore hope, function, and even intimacy in relationships that had gone quiet for years. It all starts with understanding your body and treating it not as a problem to be fixed, but as a system to be rebalanced. So tonight, when you lie down, take a moment to breathe deeply. Feel your heartbeat, your breath, your body's quiet rhythm. Those are signs of life, strength, and potential still within you. With knowledge and care, you can keep that vitality alive for decades to come. I'm Dr. Vera Sterling, and this has been your reminder that men's health isn't about perfection. It's about awareness, balance, and action. Your body remembers. You just have to remind it how to respond.